Hi, my name's Eric and I'll be your nurse today.
Hi.
First I'm just going to do a general assessment. And I've washed my hands before I came into the room. She looks fine. Everything's okay. Just going to do a quick skin assessment. Her skin's nice and warm, dry. Next onto her nails. There's no clubbing. Good capillary refill. She's got good skin turgor, so that's all good. And there's no rashes, bruises, petechiae. Normally they would be disrobed at this point in the assessment so that you can have a better picture of their skin, but that's all right. I'm just gonna take a look at your scalp to make sure that it's okay. I'm feeling that there's no discoloration in her scalp, that her hair is not blotchy, that it's looking for dryness or dampness, moisture, discoloration, everything like that. I felt her head, it's symmetrical, there's no sore spots, not painful, no bumps. Just gonna palpate your facial muscles, your facial bones. Any pain?
Mm-hmm.
Now your sinuses, no pain, everything's intact. And then the maxillary sinuses, no pain with that?
No.
Okay. Can I have you open and close your mouth a couple of times? Looking at her temporal mandibular joint, and there's no clicking, which is a good thing. Now onto your eyes. Just gonna look at I've done most of this in the previous assessment. Just making sure that her eyebrows are nice and symmetrical. Same thing with her eyelashes. Gonna pull down on your lower lids to look at those conjunctiva. And that's good. And now onto the ears. Just looking at both ears, making sure that they're symmetrical. No discoloration. Always looking at discoloration of skin, painful areas, sores, anything like that. Just palpating her auricles, and that's alright. Onto your nose. Can I have you look up just a little bit? Looking into her nares. And that's fine. Her turbinates are good. Can I have you close one nostril and breathe in and out? Other side. That's checking for nasal patency, and they're both patent. Now I'm gonna look at your lips. Can you open wide? Looking at her oral mucosa. Normally I'd be wearing gloves at this point. Looking at her lips and her gums. And everything's good. Can you open wide and say ah? Again? Your uvula is midline, bobs up and down nicely. Now onto your neck. Just inspecting her neck first. Her trachea is midline. Gonna check out your pre-auricle lymph nodes, post-auricle lymph nodes, occipital, tonsillar, submandibular, the submental, anterior cervical, right here, and posterior cervical. Could you shrug a little bit so I can check out your subclavian nose? That's good. Relax. And then I'm just gonna check your carotid pulse. Only checking one at a time. Good. That's all I have for this assessment. I'm gonna wash my hands. Thank you for your time.
You're welcome.